Good evening, my dear friends. Myself, Dr. Joseph Casey. Today, I am going to speak regarding frozen shoulder. See, first thing we have to understand what is the reason for frozen shoulder and what are all the different treatment modalities. And coming to the causes. See, we say that all the diabetic patient, the probability of getting frozen shoulder is high. Okay, that is one of the reason. And for many disease that could be one of the causative factor. Okay, so where the vayu has getting blocked, so whichever the disease, the pathology is the same. So tuberculosis getting frozen shoulder, diabetes getting frozen shoulder, by a fall having it. So whatever that could be, there is a common etiology factor which is leading to a frozen shoulder. It is coming different lines getting united in one place, means it can come through various directions. For example, to come to Balehannur, you can come from Chikmagalur, you can come from Ennarpura, you can come from Jayapura, okay, you can come from Kotigere. So still you reach in Balehannur itself. So different modalities, different disease, only one problem. And to understand why this problem has occurred, means you cannot tell that is because of diabetes, that is because of tuberculosis. So a higher level of understanding is really required. Now you can have to think one thing. So where the space of the joint is reduced. So if you see the X-ray, you can see the head of the humerus and the olecranon process. What we call the process which binds the humerus in its position. So that part, what is happening actually, the space which has to be in this space, now it has been reduced. So henceforth what it is happening, you will not be able to lift high, only this much, or max to max this much. So patient will not be able to lift in this way. So the space in the joint, it has been reduced. So whatever that could be the pathology. So the space has been reduced now. Where the space has went, that is the question. So, and you have to search where the vayu has went. And you have to understand, and if you bring back that vayu from where it has went, what will happen? Again the space will be established. Usually what we do, the blender mistake is that in a frozen shoulder we start pulling it straight away so that we are to get this space. So it is not possible, you will not get space. However, if at all if you manage to have space by just pulling and exerting pressure, what will happen? The intelligence will retrieve it back, because that was a manipulation technique which you have done, by which created a small space. But body will not allow that thing. Again the same movement, patient will tell after 2-3 minutes, sir, the same thing. Now a higher level of understanding you have to go, means you have to search where is there is a extra space, fix that with the Dawn therapy and energize the Verma points and activate it. If at all if needed, give some acupuncture. So what will happen? The nerve activation, the intelligence relation, the vayu will circulate all throughout the body properly. And to know where there is a block, you have to understand nadi. And if you know nadi, then you can understand, oh, there is a block over there, okay, we have to release from there. And that thought process, if you are getting, and if you know nadi, and if you know all those treatments, so almost instantly, or maybe 70% of the patient will be getting corrected the same moment itself. And you have to give a correct sleeping posture along with few medicines, so that the conduction of vata, pitta and kapha will be efficiently managed. This itself will treat the patient. So what thing you can tell is that, as I have told in the previous video, take oil bath with sesame oil. One thing, you have to increase the pitta. You can give some Eranda Brasta Haritaki to increase the digestion. To do the Vata Anulomana, you can give Kankayanavati for Vata Anulomana. Vata Anulomana means to pass out the Vata. If digestion is weak, you give along with jeeraka. Take little bit of jeeraka and little bit of garlic and little bit of ginger. Crush it, add into the water, boil it, and from that anupana you take kankainavati or erunda brashta haritaki. That will resolve the problem. See, now what we have done, rather than a painkiller, what we have managed, we have made circulation of the vata throughout the body, by which pain has reduced. Pain is an indicator, pain which should not be reduced without understanding where there is a block. Simply reducing the pain by just painkiller, what will happen, you just understand, the patient further goes for a deep seated, that is vata enters first rasa, then rakta, mamsameda asti, majja, shukra. So deeper level of vata enters means dhatu paka will occur, dhatu shoshana will occur, emaciation will occur, rotatory calf muscles get emaciated, and how you are going to recover a patient then. So it is a difficult job then. So now in the starting stage, if you are able to understand in this way, so most probably now Ayurvedic doctors have a intelligence like an allopathic doctor, where patient comes with pain, they put on with the Vatahara drugs, Vedana Stapana, Rasna, Guduchi, Rasna Saptaka, Amrutottara Kashaya. Okay, well, fine. Flexi, liniments, oil, and all. So, where if you are able to understand in this concept, simple medicine can relieve the greater problem. So, need not have all these big medicines. Simple thing, you can reduce it. Okay. So, for any clarification, you can call me, you can talk with me, you can WhatsApp me. Have a good day. See you. Thank you. മാക്സിമം ബുദ്ധിമുട്ടി അല്ല അങ്ങനെയല്ല, സ്ട്രൈറ്റ് തന്നെ നിൽക്കുക, ദേഹം ചരിക്കാണ്ട് സ്ട്രൈറ്റ് നിന്നിട്ട് എത്ര പൊക്കാൻ പറ്റും? അത്ര അല്ലേ? ഓക്കെ ഫൈൻ. താഴെ വിട്ടോ. ഇപ്പൊ പൊക്കിക്കേ. വേദന രണ്ട് കൈയും പൊക്കി, അങ്ങപ്പുറത്തെ കൈയും. ഓക്കെ ഫൈൻ.